Hello, and welcome to CDO Magazine interview series. I'm Andy Sajus. I'm a principal client solutions architect here at AHEAD, and we're partnering with CDO Magazine in a series of interviews with today's data and technology leaders. And today I have the pleasure of talking with Stuart Rabinowitz. He's the Chief Technology Officer at ARC Healthcare. Thanks for joining us, Stuart.
Thank you, Andy. Good to meet you.
Yeah, of course. So, Stuart, tell us a little bit about yourself and ARC Healthcare.
Yeah, so I've been in the information technology strategy and architecture space for probably 30 years. First part of my career was in telecom with AT&T, and then I made a move into healthcare about 15 years ago, working for many government agencies, Medicare, Medicaid, Health and Human Services, and building systems, designing systems, managing large project teams. And, I have a degree, undergraduate degree from Temple, a MBA from Lehigh University, and a Master of Science in Health Informatics from University of Illinois at Chicago. And so I'm about as much of a data geek as you can come across, right? In my spare time, I like to take walks with my dogs and play with my drone. From ARC Healthcare, ARC is a small women-owned company. Our business is to help our customers, navigate the complicated world of payer and provider relationships, which include everything from building new networks to contracting to credentialing providers. And by credentialing, I mean making sure that they have licenses and they're all of those kinds of things are up to date. We work with our clients to deliver the best value and help them build out those networks with the best possible set of folks that we can find. As part of that, we have productized our own internal CRM tool called 4Leaf, and if you go to go4leaf.com, I can give a little plug there. 4Leaf's a platform that's really built from the ground up to help organizations who have to manage large volumes of provider and payer information, everything from contracts to credentials. It's built on modern cloud technology. It's a software as a service. And it's really designed probably for the small to mid-sized business that doesn't have the either the staffing or the funding to build out their own set of technologies. And so we're very eager to work with folks who are building networks or consolidating networks or looking to analyze how well their providers are providing services. So thank you for allowing me to give the introduction.
Yeah, of course. No, that was perfect. That was great. So with COVID, with the healthcare industry, we've seen no shortage of challenges and over the past year. And I want to know from your perspective, how have you seen technology be a supporter of business goals where it maybe was not before?
Yeah, well, I'll talk about COVID, and then I can talk a bit more specifically or more generally, if you will. The COVID, right about this time last year, I guess about March of last year, when COVID hit, we decided to close our office down. We took everybody virtual. So we were fortunate that we had a good account team with Zoom. We already use Zoom for our call center operations. And we were able to I wouldn't say seamlessly, but we were able to transition to that. I would say our hardest problem was figuring out what to do with all the leftover equipment. So we had to dispose of that and data cleansing because we deal with PII and PHI. Sure. And so, COVID was an interesting challenge. We've had to really up our security a little bit with there's been a tremendous uptick of phishing attacks across the board. So especially anybody in healthcare is getting tagged, if not daily, every other day. So did that help you with COVID? That give you a good sense of where we are with COVID?
Oh yeah, absolutely.
All right. From a broader perspective, our business challenges include at the baseline is we automate business processes for our customers. So our goal is to reduce the amount of labor and what's called the administrative burden from the healthcare space. About 30% of all provider payer costs go towards administrative tasks, one of which is maintaining and managing and running the network, right? So we're squarely focused in on that. And technology has been evolving to help us along that way. We use a variety of tools in the Microsoft suite that have been rolling out new robotic process automation tools, new machine learning language, new no-code environments that have worked pretty well for us to build out our tools and to help our customers. We use newer tools like machine learning and even artificial intelligence are things that we're looking at. And we do everything from looking at network adequacy, which is the degree to which a payer, an insurance company, has enough doctors covering their location, their geographic locations. And we integrate data sources to do credentialing, which is verification of price of licenses and whatnot. And I think our number one priority when it comes to data and analytics, which at the end of the day, that's really what we do, is we need to have clean, accurate, and verified data that we can depend on. And that's really a lot of what our time is spent on, is making sure that data is clean, verified, and accurate.